And good morning. I'm Dr. Deuk Majan. It's September 24th, 2024. I am broadcasting our surgery live from the Deuk Spine Institute here in Florida. Our patient travels from Houston. I earlier thought maybe it was somewhere else, but it's Houston, Texas. And she presents with cervical facet joint pain from C5-6-6-7-7-1. That's 3 facets on both sides. And we are here to treat those facets with our plasma rhizotomy. But what is the plasma rhizotomy? And by the way, let's look at the AP view. Jordan, count for us, please. That's right. Sorry, so let's try again. So there's 7, 6, 5, and 4. Good. So I'm on the left side. We're going to start with the left facets. I'm trying to make my way down to the facets. It's a little too medial there. Medial means towards the midline. We want to be a little more lateral. What are we doing here? Henry, let's show the audience how facet joints can be so painful in patients like her and how they cause so much discomfort. What is the mechanism?
Copy that.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video that we're going in basically destroying some pain nerves in the back of the neck. These are called the medial branch of the dorsal ramus. And destroying these nerves is a standard treatment, but unfortunately most doctors that treat these conditions don't know how to do the Deuk plasma rhizotomy. They only do the RFA. And the RFA procedure doesn't really work. And if it does work, it never lasts. Patients are always coming back to have more treatment. The Deuk plasma rhizotomy, on the other hand, the procedure we're doing today on this patient from Texas, this does work and it does last. Now, it is also the most painful procedure I do in this day and age. I don't do much fusions anymore, so those are out. But this procedure is painful during the surgery, and that's why the patient has to be asleep. And it's painful after. Though we didn't get too many complaints after the last one, right? Because I think we injected some medicine to help with the postoperative pain. Do we have that same medicine available?
Yes, sir.
Yeah. Unfortunately, because we're in the neck burning around the pain nerves, we're not just burning pain nerves, we're actually creating inflammation ourselves from the procedure. This is a painful surgery, so our patients have to be knocked out for the procedure, not with a tube, but with propofol, sedation. And then, of course, afterwards, she's going to have inflammation right where I've operated. You know, as her body heals, it's going to be cleaning up the area that I've had to go in and operate on. All right. So far, so good. You've shown the video on the cause of pain, but also on the treatment, correct, Henry?
Correct.
Excellent.
And we have a question
Sure, we'll take the question.
coming from Timmy on YouTube.
Timmy?
Timmy, correct.
Tim on YouTube. Nice to meet you.
Timmy on YouTube said, two-part question. First being, when doing a cervical discectomy, how much disc can you remove safely to still have proper spacing between vertebrae?
I don't know who does cervical discectomy, but I don't know who Tim is talking about. We don't do a discectomy. We do a Deuk laser disc repair. So I'm not really sure about the question. Maybe Tim can clarify it. Sean?
Their second question asking, how much of the disc do you typically remove during one of your Deuk laser spine surgeries?
Yeah, we don't remove any disc, Tim. Any disc at all. We're removing a herniation. A herniation is not part of the disc. Herniation is outside the disc. So the tear is in the wall of the disc. The herniation is stuck in the tear, which is in the wall of the disc. But we're not taking the disc out. Yeah, I think you're confusing our procedure with something else. But that said, I hope that answers your question. We don't remove any of the disc. We remove the herniation and we clean the tear. All right, do we have another question?
No current questions. We do have a comment from Timmy just saying, great, thank you for clarifying.
You're welcome. But let me answer the question a different way for Tim. We're just about done here with the left side. We're going to move to the right next. Tim, if you, by the way, it's bloodless surgery here today. There's literally no bleeding. We haven't even lost a drop of blood so far. Thank you, Luis. I'm going to put a little bit of medicine to hopefully reduce the amount of pain and inflammation she has after the surgery, which I'm sure she'll be happy about. Tim, let me answer the question a little bit differently. Let's pretend you were getting a discectomy, an actual discectomy. Hold on, move your hand. Shot. So if you're actually having a discectomy in your neck, you can have the whole disc removed. And they used to do that years ago, before fusions became popular. Surgeons would go in and take the disc out to remove the herniation. They wouldn't put anything in there. And it wasn't until later on that they realized a lot of people developed instability from removing the entire disc, and they needed a fusion. So they started to do fusions using non-instrumented fusions, using like fibular strut graft. Okay, what is a fibular strut graft? Well, you take the patient's fibula, which is part of their leg, you cut it out, cut out a segment. Turns out you don't need all the bones in your leg. And the fibula is like a really non-weight bearing bone. Kind of need it, but I guess you need the fusion more. So the surgeons, used to take a piece of the patient's fibula out and put it in that space where the disc was in the neck, and it's called a fibular graft, and that would allow fusion to occur. Okay, so that was uninstrumented fusions many years ago. Shot. Just trying to get my probe in the right spot. Shot. And then they just switched to instrument infusion. It's pretty much same procedure, fibular graft, but with a plate. You know, with a plate to hold things together. Any other questions?
No current questions. So in the meantime, do we want to show the audience of the 30 causes of neck pain?
Ah, yes, 30 causes of neck pain is a great idea. And we'll be done probably very soon, and I'll come answer questions.
Of course.
I'm Dr. Deuk Machen, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. And cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. I got some good news. We are done. I was just putting some medicine in there. Raytech, please. All right, folks. So we did the right side with a 4mm incision. We did the left side with a 4mm incision. And I just injected some medicine to reduce the amount of inflammation from the procedure. But she's facing down. My initials are there. That's what we do, timeout. And I think she's going to do fantastic. Yeah. Band-aid incisions, minimal blood loss, outpatient. What else could you ask for? Come to Deuk Spine if you have facet pain. Any questions?
At this moment, no current questions.
All right. We'll be back shortly with our third surgery of the day, which I'm not sure what it is. Lumbar Deuk plasma rhizotomy, so the same type of procedure for facet pain in the lower back, along with a SI joint, DPR, and a piriformis release. So we'll have 3 separate streams. All right, we'll see you soon. Thanks for joining us. I'm Dr. Deuk Machen.